My name is Tom. I'm the owner of Synergy Home Care. This is Giselle. She will be with me today, and we are going to be going through some of the common skills that we do as we work with our clients. And I wanted to start first with common devices. So in front of me here is a wheelchair, and the only thing I want to mention about the wheelchair that is important, first of all, with any transfer, you do want to use the brakes. The chair should be secure. The other important element of a wheelchair is taking off these pedals. So what is difficult is you'll see two pins here, and you line up the top of these brackets with each one of those pins to place them. And once you line them up, they fall on easily, which is not demonstrated here. So that's important. We would be removing those when we do a transfer. The other thing very important with the wheelchair is the ease of collapsing it to get it into your car typically. And you just pull up from the seat and it makes it easy and the chair will fold. So that is the wheelchair. This is a walker. And the important elements of the walker, first of all, there's brakes, and to engage the brakes, you just push them down, and that secures the walker. The other important element of the walker is you will see commonly a little seat here that is not used to transfer somebody. It is used for them to rest. You wouldn't want to have them sitting and you move them with the seat, but it would be a place that they could safely rest if they needed to. And to collapse one of these, you just simply lift up the seat. Sometimes you'd lift up the seat and there would be brackets, but similar to the wheelchair, it's very easy to collapse if you take those steps. So that is the common devices that we will be seeing out in our clients' homes. And this is just a walker. Thank you, Giselle. Not much to say about a walker. To collapse it, it's very easy. You just collapse each one of the ends. And typically with a walker, which we'll demonstrate, we would be in a position behind them, holding onto the gait belt, properly holding onto the gait belt, which we will demonstrate. But it's a very common device and very, very useful device. So let me put this here. And I want to now get into transfers. So first thing that is important is for anybody that we are assisting, we always, there's three always, use a gait belt. Absent of a gait belt, you cannot do a transfer safely. What is important about using a gait belt is placing it. And the first important point is you'll see this buckle and you'll see some teeth here. And as we run through the belt, we want to go between the buckle essentially and the teeth. And so we would go through the buckle and that secures it. And I'll be putting it on actually myself. So when we place a gait belt on a client, we place it at the ribs, right below the ribs. And the very most important element of a gait belt is going to be that it is firm. So you can see that I kind of cinched it on myself, and I'm gonna ask Giselle to kind of demonstrate. You want to be able to comfortably get your hands, one or two hands, I guess 2 hands, underneath the belt, but the belt is firm on our clients. If it is loose, it is going to be very dangerous. So it is very important that it's snug on them. It has to be comfortable, but it needs to be snug. The other thing that's very important when we use a gait belt, and I'll have Giselle demonstrate, our hand is always faced up. So for us to have a firm grip, We always want our hand positioned as you see it with Giselle here. And you'll see she has a strong hold. The belt is in her hand, not in her fingers. And that is very important position so that we have a safe hold. So if they were to fall, we would be able to support them to the floor. So and that's the next thing that is important, just by way of discussion. When we are using gait belts for safety, it is not to stop a fall. A gait belt's intention is to stop our clients from hitting the ground and injuring themselves. So I'll ask you to put that belt on, Giselle. It is very important that we keep that in mind, because if we're actually going to be holding that belt and try to prevent a fall, you are going to injure yourself. So keep in mind the idea of the belt, if there is a fall, is to allow us to safely lower our clients to the floor. So Giselle has the belt on, and I just want to show a couple of positions. If you want to step forward, Giselle. So you can see again my hand is firm on the belt. And if Giselle was walking and was a fall risk, a couple things, I might have her using a walker or a device. In this case, I'm just securing her with my hand. And the most important position element is that we are close to our clients. So if you think about our strength, if you were to extend your arm and there was a fall, if I were to place a book in my arm and try to hold a book with it extended, it'd be very difficult. If I did that same exercise of holding a book and my arm is in my body, I could hold that book all day. So keep that in mind. You do not have any strength if you are not close to the clients. So as you position, you want to have your arm into your body, and you want to be very close to the client. So as we are walking with our clients, we want to position our inside leg between their legs. So as they are stepping, I'm stepping with her, my leg is between her leg, and essentially if she were to go down, if Giselle were to collapse, I am going to just move her. You can kind of collapse, Giselle. So if she were to fall, I am going to position her onto my lap, so onto my upper thigh, and now I have her, and then I'm going to lower her to the ground. I'm going to keep my back straight, and she's going to be safely on the ground. That's very, very important. Again, we're not trying to stop a fall. If there is a fall, we're trying to prevent an injury. So the other thing is, thank you, Giselle, is if there is a fall, let's just talk through that a little bit. An important element of that is if there's an injury. So we are assessing. If you already know that there is an injury, maybe you could see an injury or they're screaming in pain, if there's some indicator that there's an injury, we keep them on the floor, and at that point we call 911. If they're on the ground and you assess them, it appears as though they're okay, and we want to get them back on their feet. There is a trick to assisting you to help them get back on their feet, which I will show. If Giselle were to go on the floor, go ahead, Giselle. I know you didn't think you'd be on the floor today. So Giselle is on the floor. I am going to get her back onto her feet. I'm going to use a chair to assist. So I'm going to ask Giselle to move onto her knees, if you could, and to be in a position with her hands on the chair. I'm going to position myself behind her. I'm going to take a hold on each side of the belt, and she's going to assist me. I'm going to ask her to put one leg forward, and on 3, we're going to stand up. Ready? 1, 2, 3. So Giselle is back up. I'm probably going to ask her to turn. Step back till you feel the chair on your legs and sit down. So I have now moved her from the floor safely. She is back in the chair. We are back. We now want to demonstrate an actual transfer. And what I'll say about transfers, which I think is awesome, is that you only have to learn one transfer And for any transfer you make, the skills are the same. So whether you're going from a bed to a chair, chair to a bed, chair to a toilet, toilet to a chair, all of the transfers are going to use the same skill set. So we will go into some depth on that transfer. I'm going to actually demonstrate 2 transfers. One transfer where I'm not assisting, I'm just providing protective oversight. A second transfer, I'm going to actually assist her to her feet. And one important note at Synergy Home Care is if our clients cannot stand and pivot, we will not do a full transfer. So if you are in a situation where a client cannot do those skills, that is a call to the office, and we are going to require the families to provide us a device, which we will introduce to you later, either a sit to stand device or a Hoyer device that we could use to do a transfer safely. So keep that in mind. So let me get the setup here. I am going to use a wheelchair, and I'm going to take off the stirrups and put them to the side for now. And again, the chair is going to be positioned closely. I am going to be locking the wheels to secure the chair, and now the chair is ready. So for the first transfer that I'm going to do, let me just speak to this. It is very important to give our clients very simple instructions. And one of the things, in this case we have the belt already on, one of the things, a mistake that we make is we might not give specific instructions. We might say, I'm going to transfer you to this chair. That would be a mistake. A simple instruction would be, on 3, I'm going to have you stand up. That is something that's going to connect with them. They know what their first step is. After we take that first step, we'll give them another instruction, but that is very important. There's 2 important elements of a transfer beyond simple instructions. One is when we bring our clients to their feet, a lot of times they will get kind of lightheaded. It's very common that their blood pressure lowers. It's a common condition. So when we get them to their feet, we take our time and we validate that they're okay. The other element, as we are transitioning them to, in this case, the wheelchair, we want to make sure that the back of their legs is touching the chair before they sit down. Those 2 things are so important in transfer. Back of the legs feel the seat that they're going to, and that we take time and confirm before we start moving them that they're okay. So let's get a transfer. So I'm going to do 2 transfers. The first transfer, I am not assisting Giselle, and so I'm going to take a position on the belt. I have a handhold in the back, and I just have a close position to her, and I'm going to ask her just to stand up. That's going to be our first instruction. So Giselle, when you're ready, I am going to count to 3, and we're just going to stand onto your feet, and we'll transfer to this chair. Okay. So 1, 2, 3. How do you feel?
Good.
Okay, let me just slide over. Go ahead and pivot to your left. I want you to step back till you feel the chair on your legs, and then reach with your right arm and sit down. So again, the key steps. Actually, in this case, Giselle is eager to get to the chair. She's been transferred before, but I still stopped. I asked her how she was feeling before we pivoted. And once we pivoted, we then started to take a few steps back. She felt the chair on her legs. She reached back and sat down. So now we'll actually come back over here, and I'm going to demonstrate a common transfer, which is a transfer where we are assisting them to their feet. And we will use kind of guesstimates. It's not a science on how much we are assisting. We might say 50%, we might say 25%. The point is that she is at a point where it is difficult for her to stand without some assistance. Once she is to her feet, she can stand, she can pivot, so it's still an appropriate transfer that can be done safely without the need of a device. But because we need to assist her, I'm going to take a different position. So that position for you is one of two positions. I always want to make sure, and I didn't mention that our feet are flat before we transfer and shoulder width apart. In my case, I choose a position where my legs are on each side of her legs. A lot of our caregivers choose a position where one leg is in the middle. Both positions are fine. It's just preference. So the important thing is that you are close to the client. And I always, knowing in my case, when I do a transfer, there's not a relationship, I will say we are going to be going for a dance. So it's going to be close, but you're going to be safe. And I think the parallel reminds me of 7th grade so much. So I will ask the client to put their hands on my shoulders. I'm going to take a good handhold of the gait belt. And in my case, what I want you to see is my knees are bent, my back is straight, we are close. I'm gonna have her lean forward to me, and then on 3, we're gonna stand up. So I'm gonna, when you're ready, Giselle, I want you just to lean forward and stand up. We'll do it on 3. 1, 2, 3. So I now have her up. Are you okay?
Yes.
So I'm looking for clues. If she's okay, it looks like she is, I'll ask her to turn and take a step back. And when you feel the chair, go ahead and reach back and sit down. And now she's safe. So that is transfers. And again, the most important element for the field is if they cannot assist, we need to know. Thank you. Next, we want to talk about bathing. This is a very important and common skill that we do with our clients. We assist them. And what I would say is the first step, most important step, is just to start a conversation. What we do to assist each client with bathing is going to vary. In some cases, they might need assistance with hair washing. In some situations, they would like us to help them with their back. So what I would say is just start a dialogue. How can I help you? They've been bathed 3 times a week. Depending on their cognitive ability, they can tell you what role you're going to play. There's going to be some that say, I just want you there close in case something happens. So in that case, you're just monitoring. The most important monitoring is the temperature of the water. Most important monitoring would be removing some slipping hazards, which we'll talk about. But have that dialogue. Know what the plan is. Knowing that each client is an individual, and don't be assumptive on what role you're going to be playing. So after we've had that conversation, we have a plan. We are going to transfer them. Before we start any transfer in a bathroom, the most important element is going to be to lay down just outside the tub or shower a towel. And one of the things I will say, we do that because we want to reduce a slip hazard, and it can be very slippery around a tub or shower. And one of the things we have to be cognitive about is we are now improving a slip hazard, but we are adding a trip hazard. And that's really the case with any transition. In this case, it's going to be a transition probably from a tile floor to a towel. And we have to think through, we have to be very careful with that trip hazard in place. But you do want to put down a towel to reduce a slip hazard. So I am with Giselle, and we are transferring. Let me just talk through the steps. Typically, depends on the client. I might use a toilet for her to sit down. I would help her derobe there. Sometimes they have already derobed and they're using a robe. What I like to do is, if there's a gait belt to help them safely get in, just leave a shirt on, put the gait belt on, I sit them down, I would remove the belt and then remove the shirt. So we'll in this case, maybe make that assumption that's what we're doing. As I'm bringing her into the shower, I'm just going to be doing some cues. I'm gonna ask her to step in. In this case, it's a tub. I'm going to be asking her to grab handholds, and I'm going to be asking her to back up until she feels the seat and then sit down. Let me just talk to one element here. This is not a typical bench, which you will see. We like to use this in a lab environment so you know it's available. This seat allows our caregivers to move this seat into a position so a transfer can happen outside the tub safely. And again, we want you just to know that this is available. Depending on how that transfer goes with a threshold like a tub, just to know that they maybe can make a inexpensive modification to the home and replace what would be a typical bench in the tub, which you'll see commonly with a device like this that allows us to transfer them outside the tub and then slide them in. So I am with Giselle. We've got a plan. I'm moving her into position. Go ahead, Giselle. And with your left hand, grab that bar, please, and then go ahead, step in. And good, and step in, grab that other bar, and then take a step back until you feel the chair on your leg and reach back and sit down. So we are in position safely in the shower. Now the next step, we have a plan. The next step is going to be turn on the water. And what I will say with this is I always use a perspective. In some cases, the client is comfortable setting the temperature. If that's the plan, that they're going to be doing the bathing independently and they're going to be setting the temperature, we watch them as if it's a 2-year-old. So we want to always honor them, but we have to be very careful. This step of setting that temperature is a very dangerous step. I prefer that we do it. We would set the temperature, check with our own hand, and then maybe ask them, does that feel okay? Get confirmation, and then we would go, once we're in agreement, go to work. One of the things that you will see in the home is that we always require a handheld shower head. If that's not in place for you, call the office. The other element is when we do our safety checks, if there is bathing assistance, we will ask for grab bars. If those are not in place, also call the office. Both are very important. So once we then go through the steps of the bathing is the plan that you have set. And once we are done with whatever those steps would be, the most important thing, and I always have lots of towels. When I say lots, have 3, because typically they're going to be cold quickly and we want to keep them comfortable. As we are assisting them to towel off, one thing that's very important, because our clients have very thin skin, we would never want to wipe their skin with a towel. You would want to pat dry them. And so typically I would put a towel on them for warmth, and then I would be kind of pat drying them. And then I would replace a shirt while we're in the tub, and then I would be replacing the gate belt to assist us to transfer. We're back, and I have already transferred Giselle safely to the toilet. She is there. Before I lowered her, I derobed her and lowered her pants, so she is using the potty, and I'm going to use this opportunity to change her Depends and use this opportunity. If I want, I could even change her pants, but I want to make a couple of key points. And first of all, I want to just introduce these pull-ups. I use the word Depends, but there is, for you to understand what is the front on a pull-up, there is a mark that would mark the back, but most experienced caregivers would look inside the pull-up and see that one side the padding is much higher. That would be the front of the pull-up. So I would position the pull-up in this manner to have the high side of the padding in the front. So we have actually an important element, a very safe approach to be able to assist with wiping the bottom would be to ask the client to lean forward. Just lean forward, and so when they lean forward, we're able to get access to easily wipe them, and they're in a safe position. Even if they were to fall forward, it's not going to be a dangerous fall, but it does allow us to do that wiping assistance. And so once we have done any cleanup that is needed, we're going to then dress her and transfer her up. So for me to dress her, if you were to imagine that she's been completely derobed, I am going to then place the Depends back on her. So it'd be a little bit easier, she wouldn't have shoes. But for the purpose of demonstration, all I'm trying to do, the most important element as we dress our clients while they're on the potty, which is very common, is that we want to position everything as high up as we can. So you'll see me kind of moving this as high as I can. I would then follow with her pants, maybe sweatpants, whatever it would be, but I would move both her pull-up and her pants as high as I can get them on her legs. So I would then put on her shoes. I am doing that, moving everything as high up as I can so that when we stand, I can assist her easily just to finish. I just have to slightly pull up pants and pull up, and she is now dressed. The other element is if we have things low, it becomes a trip hazard as she stands. So everything is up high for us to be able to get her to her feet and for her to be able to stand, and then allow me to just finish. If she were to stand, go ahead, stand. I am just going to finish dressing her by pulling this up, and it's in place. We now want to introduce a few of the key elements that we would be using in a situation where a client would be bedbound, or if minimizing transfers because it's a device and it's just easier, or most common reason is bedbound, maybe a hospice situation. So a couple of common devices that we use, this would be a bedpan. I will say that because of what I would say evolution of the pull-ups, we are more so monitoring the pull-ups. Monitoring means if somebody is bedbound, we are routinely checking to make sure it's not wet or there's not feces. And then if that is the case, we would be changing them, which we will demonstrate. This device would be for males, and it is just a device to capture urine while they're in the bed. Some cases we can just hand the client the bottle, and in other cases there is some assistance. So that assistance would be just placing it and collecting the urine from a male and then securing it and disposing it. So I am going to, this by the way is a very, very common device in the bed. It is a chuck pad. It is used to keep the bed clean and dry. There are instances where even with a pull-up, a client might wet through the pull-up. So this, the intent of this is to keep the bed dry in those instances. It also is a way to assist us when we are maybe removing the pull-up. It would collect any possible feces that would be in the pull-up before they were to hit the bed. They would be on a chuck pad, and this chuck pad could easily be thrown away and replaced. So I am going to, actually one more element, catheters are very common. We would be emptying the catheter bag. That is a common skill. What I would say, which is important, is that each one of these bags has a different way to release. This one is a device where you move forward and pop this release here. I've seen I've seen a clip device, which I don't see on any of ours, but you know, understanding how to drain it will be important. How to drain it is just drain it. Sometimes we use a bedpan for that purpose. So we would drain the catheter bag into the bedpan. The bedpan would then be taken to the toilet. We always empty into the toilet. We might rinse from a sink or from a shower, and then empty always into a toilet. That's how. Let me just get into gloves. If I will say this, my advice with regards to gloves would be to make a small investment, to make sure you have some in your car. They're very, very inexpensive, and all supplies are provided by our clients. And if you arrive on site and there is not gloves, that's a call to the office. But to put on gloves, you just put them on. There's no advice that I could provide in terms of putting on the gloves. Just get them on however you're comfortable. The more important element with regards to gloves is disposing, and there is a trick to that. If you are finished with your work and want to dispose the gloves, you'll see I'm pinching the glove with this hand and removing it off, and I am going to crunch this glove into my other hand so it is in place in my palm, and then my fingers are going to go underneath the glove and push it forward, and now the glove is off and I could dispose of it. We are back, and in this case we just wanted to walk through changing our client while they're in the bed, and I have put on my gloves. I am going to be checking to see if she has possibly wet her Depends or soiled her Depends with a bowel movement. And for me to do that, I would have taken off the blanket, exposed the pull-up, and for me to check, I like to unvelcro and expose the entire pull-up to see. And in this case, I do see that there has been a bowel movement, so I'm going to choose to change her. And I've prepared all of my supplies that I would need. I'm going to put a new chuck pad, I'm going to put a new pull-up on, and I always like to have a trash can close by, because as I'm cleaning her up using wet wipes, I would be disposing them into the trash. So if we imagine, in this case I don't have wet wipes, but I am going to start to clean, and this is a washcloth, but for demonstration purposes it'd be the same steps. In this case this is a female, it's not any different with the male. As I'm cleaning, I want to go front to back, and clean that area well. Dispose of any of those wet wipes. And my next step is I want to rotate her so I can remove the pull-up and also clean up her bottom. So again, to rotate her, since I'm going to rotate her away from me, I'm going to lift this leg up, and I'm going to take a position where with the leg and the shoulder, I rotate her to her side. This allows me to, once again, I'm using washcloths, but I'm going to clean this area well and dispose the typically wet wipes. I'm also going to be removing the old chuck pad. Place that in the trash. I'm going to position a chuck pad. Again, I want to position it so as she rolls back, she'll be centered onto the pad. So I'm going to fold over the chuck pad and kind of tuck it underneath her a little bit. I'm also going to take the pull-up, and again, as you look at the pull-up, the high side would be the front. And I actually kind of measure the pull-up, kind of where it might be placed on their bottom. So I kind of line it up, and then I sort of lay it down. And kind of tuck that underneath as well. Get it ready for me to rotate her back onto her back. At this point, I'm gonna rotate her this way for me to finish laying this all out. So the pull-up is laid out flat. I move her back. I always do a little bit of a pull from the bottom because there's typically a crease. So I've done that. I know that my pull-up is nice and flat. And so my last step is going to be just to reattach. What I will say about oxygen is that we do not ever make a judgment call on what the oxygen level should be. There could be instructions that might say, we want you to be at a 4 during the day, a 6 at night. And we might remind our clients to adjust that oxygen level at different times of day, but we don't ever use a judgment. If a client is checking their oxygen level with a device on their finger, if it gets below 90% and they're concerned, we do not ever make a judgment that we should increase the oxygen. I would be fitting to make a call to appropriate home health or hospice and share with them the reading and for them to provide some direction on what would be next steps. This is the cannula. I will say it is very easily placed over the ears and then into the nose. I don't want to put it in the nose. I don't know how many noses this has been on, but it is very easy to assist our clients to put it in place, and sometimes they do need assistance with that. The other thing is this would be a device in the home. It's a concentrator, and it is creating oxygen through the day. This would be a possible tank that could be used, a portable tank that we could, if we were possibly leaving the home and need to have oxygen in the car as we transport, a device like this would be used and allow them to be getting oxygen while they are away from the home.